Hi guys, my name's Sandy, and this video is just going to be discussing a few things around children's health and how dietetics can support children. So, I am a naturopath, nutritionist, and acupuncturist, and I've been in clinical practice for 12 years. I'm also a mother of two young children, so I've got a lot of experience working with children and acknowledging the role that diet can play in their life, and then also understanding how difficult it can be and challenging to change diets and work with that scenario with different types of parents. So it's a really important factor to acknowledge. You're not just treating the child, you've got to treat the parents at the same time when you're working with changing people's diets. But I just want to acknowledge, from a Chinese medicine perspective, the role of a child's health has a lot to do, one quarter actually, with the time of conception, the pregnancy, what happened at birth, and in the first month of life. And so, whatever you're doing with your treatments, you've got to remember that one quarter of what you do is kind of set in stone from that period. And so, reflecting on what the health was like for the mother, for the father at time of conception, what was the pregnancy like, was there a lot of maternal stress, what was the birth like, and what was that first month like, is a really good thing to try and understand when you're working with young children. So if we look at labour and birth, there's a lot of amazing information around there. We have a high rate now of C-section born babies, and we are starting to acknowledge, obviously, the different bacteria that are getting exposed at birth. So before we even talk about bacteria, I just want to explain that going into labour is very, very healthy. So even if someone ends up having a C-section, emergency C-section, going into labour is far more healthy for the body than just having an elective C-section. And that's because we actually secrete a lot of hormones in labour. Two main ones are adrenaline and oxytocin, so helping the baby to be alert and know it's alive, and also to remove the fluids off the lungs. So with the oxytocin and squeezing of the contractions actually helps remove the fluid, and adrenaline helps also with the lung development, so that when the baby's born, they don't need resuscitation, they can breathe. So just something to keep in mind when we're talking about labour and birth. And then coming through the birth canal, it's going to give you a whole different species of bacteria, and they're a type of lactic acid bacteria, and that inoculates the baby to set their microbiome up and their immune system and their health for the rest of their life. So they've actually done studies that if a baby's born through the abdomen and they get swabbed or seeded with vaginal fluids, they can actually go on to establish as healthy microbiome as the vaginal born baby. So that's a very interesting thing to keep in mind. And also, if this vaginal seeding and swabbing is not done, you can give a strain bifidobacterium in the first 24 hours of life, and that can also help to develop healthy microbiome. So one thing that happens is when a baby's born through C-section and they don't get the oxytocin and contractions and all those hormones that are really important to know it's alive and it's time to feed, there can be definite problems with breastfeeding. And this is a huge thing here in Australia in particular. Initially at birth, 96% of women are breastfeeding, and sadly it's down to 36% by 6 to 8 weeks. Which is very sad to think about it. And then I think by 12 months, the rates are about 10% for breastfeeding. So there's a lot of room for improvement, and there's a lot of things that people need to be educated on around the health of breastfeeding, what it actually does, why we actually want to do it, and also educating like what is healthy, what's the standard, what does exclusive breastfeeding mean, what is mixed feeding. All those things really come into it, because breast milk is very unique and you cannot recreate it in a formula. The breast milk is made up of 0.9% protein, 4.5% fats, and a lot of those fats are essential fatty acids. You've got about 7% carbohydrates, and a lot of them are an oligosaccharide type of carbohydrate, which is like a prebiotic to feed that developing gut bacteria. Then you've also got, there's a lot of antibodies that get produced. So if you're feeding, for example, and you get an infection, you will create antibodies, baby will get those antibodies to the infection. So you're also supporting each other. And then there's also this amazing research around that if a baby gets an infection, it will actually, the bacteria travel back through the breast milk into the breast somehow, and they create antibodies, and it goes back into the baby, so they don't actually go on and develop the same infection. It's very interesting, the science that's coming around breast milk, breastfeeding, and I'm a huge advocate for breastfeeding. I definitely realise that some people can't, and there are a lot of problems that come with breastfeeding, but I think there also needs to be a lot of education as to why there is a huge importance to breastfeed. There's over 800 strains of bacteria found in human breast milk, and you cannot replace that by giving a formula, unfortunately. The vitamins, the minerals, all those immune cells, it's very hard to redesign that and copy it and put it in a formula. So with formula-fed babies, I'll always advocate for a goat's milk formula. And the reason for that, if you look at the anatomy of a goat, it's a lot more similar. The proteins are a lot smaller. The digestion of a goat is a lot more similar to a human than a cow. If you look at a cow, they have 4 stomach chambers. They make a lot more of the enzymes and everything to break down the cow's milk. And they have something called insulin-like growth factor 1. Insulin-like growth factor 1 is actually going to make your cells develop really fast. It's to make a baby cow grow into a really big cow, and that's actually really bad for human cells. So we see a lot of atopic conditions, allergies, food intolerances, and all that sort of stuff developing once a baby's actually started cow's milk formula. So educating what kind of formulas, if you're working with patients, is a really good thing to support them with. Okay. So then the World Health Organization recommends exclusive breastfeeding for babies to 6 months of age, and thereafter for breastfeeding alongside a suitable complementary diet for up to 2 years. So that's stated on the World Health Organization website, and that's certainly not being met. We're seeing a lot lower rates than that. So when a baby does start queuing to have food, so some people will start a lot earlier than 6 months of age, and that's because they think their baby's giving cues that they're hungry or that they're not getting enough food through the formula and they're waking up. There's a lot of reasons that people start to question whether they should give their child food earlier on. And I see this a lot in people. They say, oh, their child's around 4 months, they want to start introducing some solids. And unfortunately, I see a lot of intolerances and gut problems and stuff arise from that. So I personally think that waiting around the 6 month mark, not every baby will be the same, is actually better though in terms of atopy, eczema, food intolerances, and just overall gut health. Breast milk is building up the immunoglobulins. It's building up the cell wall of the gut. It's making everything nice and healthy so that it can actually handle food coming in. And it's actually very easy to breastfeed or to give a formula for the 6 months versus starting to introduce foods. Because once you start introducing foods, you've got to continue and you've got to make these foods. So that's another incentive to give to mothers to kind of hold off. There is a little bit of research about introducing foods for food allergies, but there's other ways of doing it. The mother can be consuming those foods, so they can be getting it through the breast milk that way, and the research suggests that that's a much safer way to do it than giving foods particularly earlier on. If we look at foods that are given, this topic can be a hot topic with many different people. Personally, like my generation, we were Farrex babies, so we were given this rice fortified porridge. So if you look at the ingredients, it's not amazing. It's okay. It's not great though. Anything fortified, I mean, it's had to have things added to it for a reason. So there is an increased risk for iron and some of the B vitamins around the 6 month of age, but you can certainly get that through the diet and making sure the mother is getting that if they're still breastfeeding, so it can come through the milk as well. So culturally, many diets around the world, I'm just bringing this up, will be a warm style of diet as an introduction to the first baby's food, first meal. So if we look at China, what they actually do there is they make this kind of rice porridge. It's kind of like a congee, but they actually just take the milk off the top. So it's like a rice milk, they call it. So, you know, when you're boiling up rice and it gets all kind of thickish and whatnot at the top, they kind of scrape that off. That's what they give to the babies. When I looked at this 5 years ago when I was, looking into dietetics and everything, I was like, oh, I'm not particularly a fan of that. I feel like it's very carby, and there's a lot of research I was looking at back in the day around fats and good fats, and that's more important to get in, and cod liver oil and whatnot. And now, as I look more into health around the microbiome, I kind of think, yeah, well, that's rich in all the carbohydrates. They're prebiotics. They actually feed the good bacteria. So, in a way, it actually makes a lot of sense. So after they do the rice milk, they'll then do a rice porridge followed by mashed fruits and then soft vegetables, tofu and fish. So that's what a baby's weaned onto in China. They don't do that all at once. It's definitely over a process. If we look at Japan does like a rice cereal and a radish meal. They also have a ceremony when they start introducing food to the baby, and they actually have a little selection of a few different types of seafoods that they also offer to the child. Once again, everything's cooked. So interesting that I've found most cultures throughout the world have something that's cooked. In India, they do like a lentil-based rice dish. It's kind of like a khichdi sort of thing, so mushy rice with lentils, and that's kind of the staple for the next 6 months with the baby in India. In Mexico, they do a very soft kind of tortilla rice sort of thing, and then they're not given beans until a little bit later on, but they just kind of start with the basics there. In South Africa, they do a corn porridge, so a congee kind of made out of corn with fish. In Thailand, they do what's called katom, so it's a rice soup, and they actually do like a really mashy kind of fish as well, so very well-cooked mashy fish. They make sure there's no bones in it. That's what they're having there. In Germany, if you have a guess, it's potatoes, so pureed potatoes and vegetables. In the United Kingdom, it's rice cereal. In the United States, it's rice cereal or pureed vegetables. So my children's background is Kenyan, and they do sweet potato there to start with. So if we look culturally around the world, a lot of those foods are cooked. So good to know. Maybe potentially offering a cooked food as a first food here in Australia. I think it really is important to take in people's backgrounds. If you're Asian background or if you're mixed background, look at the culture, look at what the diet was like, and then you can kind of work out what will be good for you to offer your baby as a first food. So there's a lot of opinions, there's a lot of different research studies and whatnot around the first feed, but it's kind of a hard one because it does come down to culture. Cod liver oil is a highly recommended. It's a supplement, but it's full of essential fatty acids, and it's really rich in vitamin A and vitamin D to offer to babies, and it's also very protective for their immune system. Egg yolk is another one that's really rich in choline and B vitamins. Now, you can't give the egg white in that first year because of potential food allergies, but you can definitely give the egg yolk. Things like sweet potato and pumpkin and white potato are definitely good things to introduce. And if we look at those kind of the yellowish starches from a Chinese medicine perspective, we know that they're sweet, they're warm, they're very good for that middle jiao, they tonify the spleen, and that's going to be really good to get digestion supported in those first few months of eating. So we really want to enhance supporting that spleen stomach from a Chinese medicine perspective, and we want to offer a warm and slightly sweet diet. So when I say sweet, I'm certainly not talking about refined cereals, added sugar to these congees and stuff like that, which is kind of what Pharax is. I'm talking about the sweetness that we naturally get in those starch vegetables. Oats is also a good thing to offer after a few months of eating. It's a nice, easy kind of Western version of a congee, and always using organic because otherwise they can be really contaminated with a lot of gluten. There's something called baby-led weaning, which is where you offer kind of very well-cooked whole chunks of food, so nothing the child can choke on. They have to be very soft, and it's to get the baby to start feeding themselves. So I've looked into this, and I think it's okay, but like personally from my perspective, I was more comfortable giving my child mashed food, knowing they're actually getting it in. There's obviously a demand in breastfeeding that's going to increase if your child's not eating as much, and this is a huge thing to really consider. So fussy eaters is probably one of the biggest things I've had to work with in the younger, like toddler age, is when you've got a mother, they just don't know what to feed their child. They only want to eat one thing, whether it's cherry tomatoes or it's only hummus or eggs or avocado, and they're only eating the one thing. You've got to really look into what particularly is happening behind the scenes in terms of formula. Are they on breast milk? You'll find that breastfed babies can't really overdo the breast milk, but you certainly 100% can overfeed cow's milk. And like I said, cow's milk is really big proteins, insulin-like growth factor, so these things that really do fill you up. And so it might mean, working with the mother so they're comfortable, reducing formula so the baby starts increasing, and they will 100% start eating more food. The baby will not starve themselves. That is the biggest fear mothers have when we talk about reducing their formula. They're like, I can't get them to eat anything. The bottle's the only thing that they get their nutrition from. And it's definitely working with the mother to understand their anxiety around the child, and just knowing, after a couple of days, if the child hasn't consumed more food, you would continue with the bottle. But personally, 12 years, I've never seen that. They always start increasing their diet. The other thing is to look at the 5 elements and look at those tastes. So we have all the 5 tastes: sweet, salty, sour, bitter, pungent. Obviously, we're not going to be giving spicy to children. However, they do in Asia. But looking at, what kind of natural flavors we can include in the diet, so they start getting different receptors stimulated and start having different organs and meridians stimulated. So predominantly in the West, what does a child have? They have a lot of sweets and they have a lot of salty, and then we add fat to it. So they're really not getting those 5 elements stimulated, and we're setting them up to be fussy eaters just by doing that. So, adding a bit of pungent might be adding a bit of nutmeg or a bit of cinnamon on their sweet potato, or on their starchy vegetables, or to their rice porridge, or to their oatmeal. I'm getting a bit of bitter in there. You could even add like a little bit of vinegar to their pureed foods and stuff like that. It's going to be really supportive for their digestion. And, after a few months, things like sour, so a bit of lemon and lime and those kind of flavors can be added just to kind of get different taste buds and different flavors exposed to help develop different organs and open up different meridians from a Chinese medicine perspective. When we look at gut health with children, and we're seeing a lot of food intolerances, the statistics are showing there's a much bigger rate of food intolerances and allergies than ever before. There's been a lot of bacteria that have been studied that can actually significantly improve food allergies, even in peanut allergies. So there's a professor down in Melbourne University, Professor Mimi Tang, and she's doing studies on Lactobacillus rhamnosus LGG, and she's doing 12-week clinical trials on kids with anaphylactic peanut allergies, and it's so amazing. These kids that would have, potentially died from having peanut exposure, by 12 weeks they can actually have peanut in their diet. So there's a lot of room for looking at gut health, working with integrated practitioners, and just supporting the bacteria side of things from a kind of nutritional perspective. But when we're talking a Chinese medicine perspective, we want to make sure the diet's warm. There are so many people I've seen in clinic before where the child has had food stagnation affecting some condition A, B, C, or D. It could be insomnia, it could be behavior, it could be colic, it could be constipation. And we go back through the diet and we find that the diet's predominantly cold. So mashed banana, avocado, fruits, that sort of stuff, a little bit of sweet potato and that sort of thing. And also a huge one that I've noticed is people are giving their children smoothies for breakfast, and I'm really opposing to that. I do not think your child should have a smoothie for breakfast until they're a little bit bigger, because in Chinese medicine you have a immature spleen and stomach, and you just don't have the digestive fire we speak about big enough to be able to digest that cold raw diet. The food needs to be cooked, especially if it's a green, because it's rich in oxalates and other things that can really be inhibited in their absorption, and the diet needs to be warm and cooked. So when we're talking from birth to the first year of age, the diet should be cooked. There's room for bananas, there's room for a little bit of fruit in there, but there's definitely not much room in there at all. You want to focus on a warm diet, adding some good oils if you want to some of those cooked vegetables, and giving, bananas and stuff like that. A very easy snack on the road. Yogurts and stuff, they can come, but they can come later. That's certainly not going to be a problem a little bit later on. So I hope you enjoyed this video, and I hope it gives you a little bit of an insight as to the first year of life, from weaning into introducing solids. In infants, that's the age I was trying to think of. And then I'll talk a little bit about toddlers and above in the next video. Hope this was helpful. Bye.